Welcome to this presentation on HPV and anogenital lesions by CANS, the Chelsea Anogenital Neoplasia Service. HPV stands for human papillomavirus, and it's a type of virus that infects the skin, particularly the mouth, throat, and genital area. It spreads via skin-to-skin contact, such as sexual intercourse. In most people, these infections do not cause any symptoms, but can be linked to some conditions, such as genital warts and cancer. HPV testing occurs during cervical smears offered to women aged 25 to 64. If identified, you will be offered further screening, usually in around a year, to check it has cleared. Most people will clear HPV naturally within 2 years. Treatment is typically not needed unless you are unable to clear the virus or symptomatic, such as experiencing genital warts. 4.8% of all cancers worldwide are attributed to HPV infection. HPV can cause abnormal changes in cells it infects, which can lead to development of cancers. Cancers linked to HPV are cervical, head and neck, vaginal, vulval, and anal cancer. Anal cancer rates in particular are growing amongst women, and it is important we highlight the link between this and persistent HPV infection, meaning people who cannot clear the virus. HSIL stands for high-grade squamous intraepithelial lesion. These terms essentially refer to abnormal changes in cells that are not yet cancerous but could become cancerous. A key risk for developing these lesions is persistent infection of HPV. Anal cancer. The anus is where your bowel connects to the outside of your body, the bottom. Cancer here can present as pain and itching, bleeding or mucus discharge, lumps around or inside the anus, or a change in bowel habit. But 20% of people diagnosed with anal cancer have no symptoms at all. In England, all boys and girls aged 12 to 13 years old are routinely offered the first HPV vaccination when they're in year 8 at school. The second dose is offered 6 to 24 months after the first dose. The vaccine is also offered to other high-risk groups, including men under 45 who have sex with other men, transgender people, people with HIV, and sex workers. There is no formal screening program for anal cancer in high-risk patients. Patients with symptoms of a precancerous lesion or cancer, there are a number of different ways we investigate it. This can involve taking samples from the anal region and sending them for testing, or using a special scope and stains to identify suspicious lesions, such as HSIL in the anus. This is called high-resolution anoscopy. Following this, we can treat these HSIL lesions with creams or lasers. Treatment of these HSIL lesions reduces the risk of them progressing to cancer. CANS stands for Chelsea Anogenital Neoplasia Service. This service aims to increase the rate of identification and treatment of anal neoplasia in high-risk patients and reduce the number of patients in the region presenting with late-stage anal cancer. CANS also aims to improve the education on HPV-related disease for both patients and our medical colleagues. CANS is kindly supported by the Red Trouser Day charity. The Red Trouser Day charity is a charity created by patients treated at the Royal Marsden Hospital to support research activities into lower gastrointestinal cancers. As well as running fundraising events throughout the year, they also provide advocacy and support for patients with colorectal cancer. Thank you for watching this presentation.